We're talking with David Howard, a health economist and professor at the Winship Cancer Institute at Emory University. Dr. Howard, you talked about the launch price of a drug being the one that journalists should look at, and you talked about the process of price setting by drug companies. Can you walk us through those 4 steps?
Sure. So companies will often look at the price of the next best therapy or whatever the new drug is going to replace. That's often the starting point for any discussion about what price the new drug will have. They also commission surveys of physicians and insurance company medical directors to try to gauge how the price is going to affect physicians' prescribing or use decisions, and also insurance companies' coverage policies. And then finally, if the drug is in a particularly kind of sensitive area like cancer or infectious diseases, they'll look at how the price is going to affect any public relations risk, political risk, or how will it be perceived by patient advocates that the drug company has to work with in order to gain acceptance for the drug.
And which of those do you think has the biggest influence?
Well, physicians are really the party that has the biggest influence on whether a newly approved drug will be used, so they have to consider the physicians. Insurance company medical directors, however, have some ability to make life painful for drug manufacturers by instituting prior authorization requirements and other policies that can make it difficult for physicians to gain coverage for the drug even if it's approved. And so they also have to consider how insurance companies will set policies to encourage or promote uptake.
And tell us what happened with the drug Zaltrap.
Sure. So the company came out with a price that was about twice as high as the next best alternative, the drug it would compete with or the drug to which it was similar, Avastin. Some prominent physicians in the Memorial Sloan Kettering Cancer Center wrote an op-ed in the New York Times saying that they would refuse to use the drug because it cost too much. And the company came back and said, well, we really didn't mean to set it that high. We were pricing it and pegging it to a 10 milligram Avastin dose. The doctors pointed out that the commonly used dose for Avastin is only 5 milligrams. So at the end of the day, the company came back and basically cut the price by 50%.
Mm-hmm. And how does a company's R&D factor into price setting?
Right, so drug companies, when asked about the high prices of their drug, one of the first things they'll say is we spend a lot of money on research and development. But at the time companies set the price, the research and development costs are sunk. It's water under the bridge. So I don't think companies set prices to recoup research and development costs. If anything, that argument gets the direction of causation wrong. It's not that research and development costs influence prices, it's that the reason that companies are willing to spend so much on research and development is because they know they'll be able to charge high prices for anti-cancer drugs.
And tell us how patients assistance programs work.
Sure. So one of the main potential barriers to uptake of some of these costly anti-cancer drugs is that patients may have to pay a lot of money out of pocket. Many cancer patients go bankrupt paying for their care, and it's certainly discouraging to patients who don't have readily $5,000 or $10,000 saved up in the bank. Knowing that high prices may discourage some patients from taking their drugs, what companies have done is come out with patient assistance programs. So these programs operate independently of the insurance system, but they basically refund the amount that patients pay out of their own pocket. There are company-run assistance programs for privately insured patients. There are independent foundations that provide assistance to Medicare and Medicaid patients. But they basically ensure that patients are less sensitive to prices, that patients' out-of-pocket costs are not a barrier to physicians prescribing the drug.
Thank you, David Howard.
Thank you.